So I'm going to be talking about public health effects in the elderly, and I'm going to be talking about loneliness, bereavement, and elderly abuse and neglect. So the first one I'm going to talk about is loneliness, and this one kind of bent a little bit, but loneliness is the feeling of being alone regardless of the amount of social contact. Social isolation is the lack of social connectedness, and social isolation can lead to loneliness in some people, while others feel lonely without being socially isolated. So, the first thing I want to talk about is health risks. So, loneliness can cause an increased level of premature death. Social isolation is associated with a 50% increase of dementia. And social isolation and loneliness is associated with an increased risk of heart disease and risk for stroke. Loneliness is also associated with higher rates of depression, anxiety, and suicide. And in heart failure patients, loneliness is associated with a 4 times increase for the risk of death. And one of the things I found quite interesting is that LGBTQ elderly individuals are actually more of a risk than, say, I would be, because they don't go get health care because of discrimination or stigma and barriers to care. So some dangers of social isolation include, as mentioned before, health conditions. So like loneliness can be just as deadly as obesity or smoking even. Habits increase. So their bad habits increase. So smoking, drinking excessively, and not getting physical exercise. Alzheimer's disease. So loneliness is actually a risk factor for cognitive decline. And isolation leads to higher instances of elder abuse. And this is because the elderly are more likely to fall for scammers and financial abuse. Neglect goes more unnoticed. And seniors are less likely to report any physical abuse. So now we're going to talk about some of the causes of loneliness. So loneliness can be caused by family dynamic changes, and that's one of the big ones. So divorces right now are at an all-time high, and the birth rates nationally are at an all-time low. Women often do live longer than men, so they're widowed, divorced, or they just never get married. Transportation challenges, so this leads to social isolation as well. New technologies and lifestyles are very overwhelming for seniors, and contrary to belief, elderly married couples can be socially isolated as well, and this is because when they're younger, they're more focused on having their children and caring for them, and then as they get older, they one of them usually ends up taking care of the other one, and that individual has more of a risk for emotional isolation, since they don't really have time to go out for activities or other social outings. And seniors also who find themselves unexpectedly alone are at higher risk for related complications of loneliness. And this is because, like, if you age without somebody, it's completely different than just losing them just like that. So now we're going to talk about what we can do to help our seniors who are feeling lonely or socially isolated. So we need to make time for our seniors. We need to call them, video chat them, and encourage other families to do so as well. Right now, social distancing for COVID has put senior isolation basically at an all-time high. And yeah, but it has shown us that we can communicate in different ways. So we've learned to video chat, we've learned to have those little picture frames that we can automatically send them pictures from the cloud, and videos can too, so I just think that's awesome. Volunteering. So I know at the hospital, the seniors or some individuals are allowed to volunteer in the surgery area or putting brochures out and stuff like that. Right now we can't really do that, but it's still a really good opportunity for them to get out. And I know some nursing homes around here also have opportunities where you can go and volunteer and help out around there, which I also think is great. So exercising. Exercising helps with that as well, and it even helps to, exercising you can do with groups. So you can get a group of seniors together, they can go on walks, they can go golfing, anything to stay active and social. Senior living also helps with loneliness. So elderly adults are less likely to feel lonely when they can spend time with their friends and peers. So if they're in a senior living facility, they don't have to worry about transportation or their family dynamics because it's just them. So they can enjoy the things. And then groups. Getting together groups for hobbies like golfing and sewing and knitting and even watching movies or a book club. Those are great ways to help combat being socially isolated or loneliness. So now we're going to talk about bereavement. So bereavement's on this side. I don't know if you can see it that well. Okay, so I'm getting it. Okay. So bereavement is being deprived of a close relation or a friend through their death. So losing someone can be very distressing, but it is a very common thing for people to face. Most people experience normal grief and bereavement, have a period of sorrow, numbness, and even feel guilt and anger. But gradually these feelings should ease and go away, and it's possible for them to accept the loss and move forward. But for some people, this feeling of loss is so almost debilitating, and they don't improve even after time passes. And this is known as complicated grief. And complicated grief, painful emotions are so long-lasting and severe that they have trouble even recovering from that loss and resuming their own life. So different people go through different phases when they're experiencing grief. They have other relationships, adjusting to a new reality, allowing their self-experience, and accepting the reality of their loss. So, people go through this at different stages, and they don't even go through it in the same order. It can be however they feel like dealing with it. So now we're going to talk about signs and symptoms of complicated grief, and there are so many of them. Depression, suicidal thoughts or behaviors, anxiety, PTSD, alcohol, intense sorrow and pain, problems accepting the death, bitterness. Some people even have the feeling that they wish they had died along with their loved one, or they feel like their life isn't living or worth living now because their loved one has passed on. So some of the risk factors of bereavement and complicated grief is an unexpected or violent death, like a death from a car accident or a murder. If a child has died, close or dependent relationship to the deceased person. So let's say a child was taking care of their mother and the child passed. Past history of PTSD, depression, anxiety, traumatic childhood experiences, and financial hardships. So some of the complications, as I mentioned before, depression, anxiety, PTSD, alcohol and nicotine, substance misuse, all of that. So prevention. What can we do to prevent bereavement? So talking about the feelings and allowing yourself to cry, and it prevents you from getting stuck in the sadness. So that's really important for elderly to get out there and really talk to it. There's support groups for grief, there's grief counseling, there's many different options out there. And then support. Family members and social groups, like I said, or friends are great supporters for when this type of thing happens. So it's great to talk about what's happening, and even talking to the doctors. They can have great local resources, or they're even great to talk to if they have the time. And then, as I mentioned, bereavement counseling. It's great, and it helps you, it kind of counsels you through your way through the loss, and it goes through all of these phases. And the last thing I'm going to talk about is elderly abuse and neglect, and that's this big section right here. So, Elder abuse includes physical, emotional, or sexual harm inflicted upon an older adult, their financial exploitation or neglect of their welfare by people who are directly responsible for their care. In the U.S. alone, more than 500,000 reports of elder abuse reach authorities every year, and millions more go unreported. So there are many types of abuse, and that's what I'm going to be talking about right now. So that's right here. We have physical abuse, which is the non-accidental use of force against an elderly person that results in physical pain, injury, or impairment. And this does not only includes physical assault, it also includes hitting, shoving, inappropriate use of their drugs, restraints, and confinement. Emotional abuse. This is the treatment of an older adult in ways that cause emotional or psychological pain or distress. And this includes intimidation, through yelling or threats, humiliation or ridicule, blaming or scapegoating, ignoring the elderly person, terrorizing or menacing the elderly person. And then there is elder neglect, which is the failure to fulfill the caretaking obligation. This constitutes more than half of all reported cases of elder abuse, and it can be unintentional or unintentional, and it's based on the factors of ignorance or denial that the elderly charge needs as much care as they do. And then financial exploitation, which is the unauthorized use of an elderly person's funds or property, either by caregiving or an outside scam artist. And then the next one is healthcare fraud and abuse. It's carried out by an unethical doctor, nurse, or hospital personnel and other professional care providers. And then the last one I have is sexual elder abuse, and this is contact with an elderly person without their consent. And this can even be considered that if you show them pornographic material. So now we have the warning signs. There are many warning signs that go with abuse and neglect. So warnings of physical abuse can be unexplained signs of injury, bruises, welts, scars, broken bones, sprains, dislocations, broken eyeglasses, and signs of being restrained. Emotional abuse, warning signs, can be threatening, belittling, and controlling caregiver behavior. Sexual abuse warning signs are bruises, torn or stained bloody underclothing. Elder neglect or self-neglect warning signs are unusual weight loss, malnutrition, dehydration, and bed sores, left dirty or unbathed. They can even have inappropriate inappropriate clothing for the weather, and living in unsafe living conditions. So there's no heat, no running water, or more fire hazards. And then financial exploitation is sudden changes in the elder's financial condition, items missing from the house or from the household, and changes in the will, power of attorney, and titles. And then healthcare fraud or abuse warning signs include duplicate billing for the same medical service or device, and problems with the care facility, stuff like that. So some risk factors, which is down here, depression of the caregiver, lack of support from other caregivers, substance abuse from the caregiver, a history of domestic violence in the home, the elder's own tendency toward verbal or physical aggression, and social isolation. So prevention, what can we do? So call as often as you can and help the elder to see you as a trusted, confidant person. So make sure we're video chatting and being involved in that person's life. Monitoring the person's medications, just so we know they're getting properly taken care of. We know that they're taking their medicines as they should be. Watch out for the warning signs, and watch out for financial abuse. So check their bank accounts if you can, and for unauthorized transactions or anything that's weird that's going on. And then one thing that I found that isn't on this board is how the elderly can even protect themselves from abuse. So keep in touch with their family and friends and avoid becoming socially isolated. And if the elderly are unhappy with their care, then they can speak up and tell someone, because even if it's in their home, they still have a right to their care. And then the last thing the elderly can do is to make sure that their financial affairs are all in order. If they aren't, enlisted a professional to help them, while that way they know everything's set in stone, nothing can be changed. One of the things I'd like to talk about lastly is reporting it. So anyone can report it as long as there are definite signs. So make sure if an elderly person comes up to someone, that they report it. Alrighty, well, I hope you enjoyed my presentation, and thank you.